Y'all know how to do that?
Yes, sir.
All right. So we'll check our pulse ox, see if our patient breathing rate and quality. All right. So if my patient's only breathing 4 times a minute. All right. So we're gonna get rate and quality. We're gonna get the pulse ox. And once we find out the patient's not breathing adequate, we're gonna say less than 10. Okay. That means they're breathing between 1 and 9 times a minute, which is not adequate, especially if they're unconscious. Okay. Then we need to breathe for them.
Okay.
All right, we'll be saying BVM though.
BVM.
Short, right? Okay, BVM. So a BVM, we can breathe for the patient. You have to cover up the mouth and the nose. The mask is made with an apex and a base. The pointed part go over the bridge of the nose. And this go over the lower bottom of the chin, just below the lower lip. So the mask makes a seal right here. That's where you make your seal at, okay? So you gotta cover up the mouth and the nose. And the way you hold it, we call it a C-clamp, okay? And you grab the chin to pick it up, to hold it, okay? All right, so we'll do this on the little dummies later on. All right, so you hold that, pick it up, and give 1 breath every, anybody know?
5 seconds.
Every 5 to 6 seconds, but we're gonna leave 6 seconds in here, how about that? I'm gonna give 1 breath every 6 seconds, so I'm gonna count 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000. Y'all got that? All right, so how do I know I'm getting adequate air? Chest rise.
Yeah.
Y'all won't see this on the unless you got X-ray vision. But this is a training mannequin, right? Everything. So you can see what happens underneath all this. You do have a couple lungs in there, okay? All right, so that's a breath. Now, in order to maintain an airway, we have to use what we call airway adjuncts. OPA, NPA, oral pharyngeal airway. Everybody say that?
Pharyngeal.
Nasal pharyngeal airway.
Nasal pharyngeal.
All right, so now, as you can see, the oral is made with a curve in it. You know why?
Holds the tongue back.
Keeps the tongue back. I'm gonna do a cross finger technique. I'm gonna go in upside down. I'm gonna rotate 180 and the airway edge it in there. And then I go back to bag in again. Y'all got it? Now what if my patient is gagging?
You can't use that. You
I
have to use the
take it out.
nasal.
Can't use this if they got a gag reflex. Y'all got that? All right, there's another way you can put this in. You can take a tongue depressor. This is actually a bite stick, but there's a couple of tongue depressors back there. They look like a little popsicle stick, the thing the doctor sticks in your mouth. Y'all know what I'm talking about? Anyway, if you put this in first, down to just to the base of the throat, then you can go straight in with the OPA. Now, if you stick this in somebody's mouth, they start gagging, you know you can't put this in. That makes sense? Now, if they got a gag reflex, you can use a nasal. Only thing about a nasal, it's got to be lubricated. Bring me a little spray. See that little spray bottle? Yeah, there you go. All right, so on these mannequins, we have to put a little lubrication on here, but in real life, we'll use some like water-soluble solution, like KY jelly. Y'all know that? They got that on it. I got to lubricate the nostril in there because it won't work if we don't. Got to do both sides. All right, so now we got it lubricated and we can get it to work. And that's all you do. Once you lubricate it one time, y'all, you don't have to do it no more for the day. Y'all got it? All right, so we verbalize it. So how do we know what size to put in? That's a good one. All right, so for the OPA, the corner of the mouth, the tip of the earlobe. See that? So down on this side, corner of the mouth, tip of the earlobe. Nasal, the nostril to where? Tip of the earlobe. Y'all got that? Nostril, tip of the earlobe. So you want to make sure you measure. How you know how fat you want to do it? You look at the nostril, get the right size. Danny, pass me that big box of, yeah. Danny's my assistant today, he don't know it. As y'all can see, there's various sizes in here. And that's where they're gonna be on your truck. They even got some smaller size for people, for younger people that's got small nostrils, y'all got it? So make sure you use the right size to fit with the patient. All right, so we lubricate it. And when we do this, you see how, notice how that NPA is cut? That's called a bevel. Y'all know what a septum is? That's that little skin that divides your nose from right to left. So it's gotta face that. So once I measure it, lubricate it, now I'm gonna insert it, pull the nostril back, let the bevel facing that way, and it's in, okay? And now you can continue to bag your patient, okay? One breath every what?
6 seconds.
Right, there you go, all right. So y'all know how, I show y'all how to do the OPA, NPA, okay? Y'all got that? When can't you use this?
When the person has
Gag
gag reflex.
It's time you can't use this. If they got punched in the face, they got a swollen nose, bloody nose, do not use one of these. Y'all got it? Okay, any trauma to the face, you cannot use an NPA. You still can use an OPA, as long as they don't have a what?
Gag reflex.
Y'all got that? All right.
So what if you can't use either?
What's that?
What if you can't use either?
What if you can't use either? Do it without it, right?
Thank you.
There you go. All right. I got another little airway we're gonna talk about here in a minute. All right, so I just wanna make sure, I did assessment, I did the ventilate with the BVM without the OPA, then I inserted an OPA, right? Went over there and we did the NPA. Now I gotta show you how to